It's my absolute pleasure to welcome Justin Lee from Heliogenomics to Impact 2022. Justin, welcome.
Thanks for having me.
Really great to have you. So just to kind of kick us off, can you tell us a little bit about what Helio's origin story is, where it all started from?
Of course. So Helio was actually a technology out of UC San Diego. There was a professor there who was a well-known geneticist working on a process called methylation for human aging. And we got in touch with him and had the idea that it could be applied to cancer detection. So we worked with him together to spin out that technology from UC San Diego into the Helio organization and then continue to build on it to make the products that we offer today.
That's incredible. Now, from our conversation last night, you don't have a medical background.
I don't.
So what was it that inspired you to sort of get into the medical space?
So my background is in business and finance, and I think I spent a lot of time in more or less zero-sum games, right? You make money, somebody else loses money in finance. And I wanted to do something that was a little bit bigger than myself and contribute to society and help people. And for a while, I thought that maybe I should go back to school and become a doctor. But I was old at the time. I was fairly old, relatively old. And I decided there was maybe a better use of my business skills that I could apply to the medical field to impact a lot of lives and help save lives.
Excellent. And for our audience, can you sort of give it a very simple, high level, what it is that Helio does, what solution it provides?
So Helio makes cancer testing simpler and more accurate. So instead of getting scopes and images like colonoscopies and mammograms in the future, we envision a world where you can get a blood test or a saliva test or a urine test and be able to accurately tell if you have cancer and then follow up with the medical standard.
That's incredible. We talked about this last night. What are some of the complications you feel right now? Why is it that people either don't want to get tested or they kind of find out they have cancer too late?
I think part of the problem is that people want to be healthy when it's convenient for them, right? So if it takes them a separate day off of work, if they have to schedule around it, if they have to deal with customer service and things like that, there's much more friction to get them to make that decision to get cancer screening. So we want to make our product as one click as possible, like Amazon, and we want it to be just part of regular life, right? You get a cancer test as part of your annual screening. In the future, we even want to bring that screening to your house so that you don't even need to leave your house.
Well, that would be super convenient. I mean,
Yeah.
I think you'd have a lot more adoption if people came to the house for that.
Absolutely.
Is there a certain area that you're sort of starting off in? I mean, you're live right now, right?
We're live.
Yeah.
We're in hospitals.
That's absolutely fantastic.
Yeah.
And is there an area of focus right now where you've started?
So we've started in liver cancer.
Okay.
Liver cancer is our beachhead because it's a large unmet need. There's actually 80 million people in the US with fatty liver disease, which is caused by obesity. Wow. That population is growing, and those people are all at a higher, more elevated risk of liver cancer. So, and ultrasound, which is the current standard of care, is particularly poor, misses almost half of cancers.
Oh my goodness.
So we decided to make that our first test. We've also launched a colon test, and very shortly after, we'll be launching additional tests.
Correct me if I'm wrong, but I mean, you see that the future of Helio is to be able to test for all types of cancer, correct?
We want to be a complete, comprehensive cancer solution.
Yeah,
yes.
That's fantastic. Can you talk a little bit about the importance of AI in healthcare? Obviously, I come from an organization where we use AI, in a lot of elements. How are you using AI as it applies to healthcare?
So artificial intelligence and machine learning is critical in what we do. Anything in cancer detection, we're really looking at a complex disease that can look very different in different people and also throughout different times. So we're looking at DNA in your genome. We're looking at multi-dimensional analysis. We're looking not only at specific positions, we're also looking at how your DNA is organized. And really, at the bottom line, it's trillions of data points, right? So to make sense of all that data and to train a model that can accurately tell if somebody has cancer requires big data and AI and machine learning.
A human brain simply doesn't have the power to process that information.
Exactly. At least mine doesn't.
Neither mine, my friend. How are you thinking about the sort of the customer end user and making it easier for them?
So we want to make the test as simple as possible. I mentioned we want to bring it to patients' homes. We foresee a model where you can have somebody show up at your house and take your vitals. They can telemedicine in a physician. It could potentially be a nurse, right? And we want to provide our test through that model so that it just becomes part of regular care and bring down the friction that's required to make a decision to be more healthy and to stay alive. Because most people, a lot of, I think the culture in America is a break-fix culture,
Yep.
right? People want to save their health once they get really sick and they're dying. And we would like to change that and make people more preventative.
It seems if I think of something like, automotive, most people are very comfortable with the idea of getting oil changes on their car, 30,000 mile service, 60,000 mile service. Why do you think we don't think of sort of preventative, maintenance for health the same way?
I don't know.
Is it too
I think
hard?
It's just, I think partly the tools have not existed, so you don't have the government push as hard for regular screening intervals and health policy around it. So I think the evolution of liquid biopsy cancer tests like ours are going to help change that over time. Now it takes the medical system in America, a long time to adopt things, but I think we're taking a good step towards it.
Excellent. And you very much see this as a future of this is a direct consumer model where I don't have to go to my doctor to request an appointment to get all of this, correct?
That's right. Yeah, we want to be the entry point, right? And then once hopefully you don't, hopefully you just get peace of mind, you don't have cancer. But if you do get cancer, you want to know as early as possible.
Yep.
And that's when you go to the hospital, you see a specialist, and you go through the normal standard of care.
And do you see a future where you're able to bring the price point of the solution down to a point that, an everyday middle-class consumer would be able to access it?
Absolutely. Our goal is to make this test prolific. We want to provide access to the people who really need it. So we want to bring our price point down to a level that's affordable, even out of pocket, right? Insurance takes a long time to get. So I think our goal is to ultimately get the test to become a couple hundred, maybe $300.
That's very affordable.
Yeah.
Well, listen, my friend, it's been a pleasure having this conversation. I wish you a lot of luck, and I look forward to seeing the growth of the business over the next few years.
Thank you
Thanks
so much.
for joining us.
Thank you.